So let me stop recording, pause recording. Okay, so it looks like we're going there. And you just want Gina to get on, or are we just going to go without her?
Yeah, let me just see if she's finishing up a meeting.
Okay.
And then yeah, we'll
Since
turn it
officially it's her coffee,
we'll turn it over to you.
All right. Well, hello everybody. It looks like I have this recording. For those of you who haven't met me, I'm Christina Benoit. I'm the school nurse here. I'm affiliated with the Town of Newtown Board of Education school nurses. I'm not an employee of Fraser Woods. So with that, I get a lot more updates from the health department of the town and also with the state. And hopefully I'm working with the latest information that we have been given. And I'm just going to go over and start my presentation, just a review of COVID-19, some of the changes that we're going to be having here at Fraser Woods, and I'm going to get started with that. All right.
And I have to give you.
So I got to hit share screen. You
There's-
disabled my participant screen sharing.
Yep, I'm gonna give it to
Got to
you.
enable me. There we go.
Liz is on a phone call, I assume, with Gina.
Okay.
Oh, they will get. So I should be able to share? Nope, still
No,
disabled.
not yet.
I got to get rid of me, Allison. Help.
So on the bottom, stop video.
I know. I have to do this on my iPhone because my. Okay, got it. Great.
Okay. Okay, you should be able to share now, Christina.
Aha. There we go. All right, can everybody see the COVID-19 screen? Yes?
Yeah.
Okay, wonderful. And I'm just going to hide you guys for a minute so I can see what I'm doing. All right, so obviously we're going to do the update for COVID-19 and what's going on with the changes that have happened not only nationally, but locally here in the state of Connecticut. Just as a review, because I always think it's helpful to review what's going on with COVID-19, the symptoms that people are aware of. I know that we hear it every day. Oh, do you have any symptoms? But we just want to remind you about the fevers and chills, the cough, shortness of breath, muscle aches or body aches, headaches, things like that. It feels like you have the flu. By the way, the flu is going around as well. So if you do start having any of these symptoms, contact your doctor, get tested. They may test you both for COVID and for flu. Don't be surprised. Obviously, if you have any problems with warning signs, don't be afraid to call 911 and get to a hospital. We're in a much better place with hospitals here in Connecticut. Get the help that you need. What can we do? This is actually more important than ever right now. Is best way to prevent the illness is to avoid being exposed to the virus. This virus is spread person to person. If you listen to the news last night and this morning, there's even more evidence that this is being spread by people who are asymptomatic. And we need to maintain the distance and the mask wearing and hand washing so that we can prevent ourselves from getting this virus as best we can. Again, cleaning your hands often and avoiding any close contact, limiting the contacts with others as much as possible. We don't know, it says avoid close contact with people who are sick, but the problem is we don't know if people are sick with it. So it's very hard to do, but doing your best to avoid contact with other people. One of the things, obviously wearing masks and stuff like that. One of the things that I think is interesting is this slide about your bubble, what you think you have as the bubble of friends who are in your safety zone. We all have the couple of people that we'll see regularly, but we don't realize actually their bubble isn't identical to your bubble. And once you start interlocking all the different bubbles, you can see how you can get exposed without meaning to. And since we do know that the transmission of COVID-19 is happening much more frequently now with the variants, and because most people are transmitting it without having any symptoms at all, thinking about the people that you're near is much more important. I want everyone to really take at this and internalize this picture, because you know, I even heard about it today about somebody who had contact with somebody who was in their bubble, and the person had no symptoms, but they found out that somebody else at work had it. And even though that person at work had no symptoms, now they ended up being tested and were positive, and here it goes. And that was just this morning, not an hour ago, that I heard about this. So please look at the people around you, really decrease the amount of people you're seeing, only make trips outside the home that are essential. And it's hard, but social distance, social distance, social distance. All right, let's get into the important things though. Travel advisory changes. As we all know, just before Christmas, the state of Connecticut changed its travel advisory. It no longer had good states and bad states. Right now, we only have the territories of New York State, New Jersey, Rhode Island, and Connecticut. We've all formed a conglomerate. Those are the only states that we can travel into and out of without asking for a quarantine following traveling to those states. Yes, you do need to be out of the state of Connecticut for 24 hours for this to take effect. So if you have to drive over the border to Massachusetts to pick up something and drive right back, that does not count. But if you are out of the state for more than 24 hours and you are not within New York, New Jersey, Rhode Island, then you must follow the self-quarantine travel advisory. It is a mandate from the state of Connecticut. Now, as I said, it is a 10-day self-quarantine. Everybody's like, yeah, but you can test out. These are called exemptions. So the state of Connecticut is still recommending the 10-day quarantine, but if you need to, you can have one of the exemptions. The state says that a person coming to the state of Connecticut can have a test taken for COVID-19 72 hours prior to arrival, and as long as that test is negative, they do not need to quarantine, or you can have it anytime following the arrival in Connecticut. And as long as that test is negative, you do not have to quarantine. Though all of this information does need to be provided to the Commissioner of Public Health. And if you look on the ct.gov website for travel advisory, it tells you how to submit that information. If you do not do this, you can be subject to a fine. Fraser Woods has been looking at the increase in transmission rates and the fact that we are having variants that are much more easily passed from one person to the next. And we are going to change and not accept the exemption from the state of Connecticut. We will follow the fact that there is a 10-day quarantine period from the time of last contact with the infected state or country. But starting this coming Monday, we will not accept the state of Connecticut exemptions for travel self-quarantine. What we will accept is that a person who is under this quarantine can perform and have done a molecular or PCR COVID-19 test no earlier than 5 days after the last contact with the identified state or country, and that once they have a negative test, they can return, but that must be submitted. The self-quarantine must continue until the results of the test are provided to us or at the end of the 10-day period. So if you traveled from Texas yesterday would be your day 0, today would be day 1. And on day 5, you can have that COVID test. And as long as those results are negative, you can come back to school. There are rapid molecular tests out there. They're hard to find, but they are out there. So there are people who are getting molecular PCR tests done rapidly and find out within 20 minutes what the results of their tests are. Most people are dealing with the regular PCR test, which takes usually 48 hours to get returned. So you're home for 7 days. But we need to make sure that our children and our staff are safe. And this is what Fraser Woods has determined will be the best way to keep our staff and our children safe from people who are traveling into and out of the area. Next, we've had other changes from the CDC and the Connecticut Department of Health regarding regular quarantine. Again, the CDC and the Connecticut Department of Public Health still recommend a 14-day quarantine after your last contact with a person who is positive for COVID-19. During that 14-day quarantine, you're going to continue to monitor for symptoms of COVID-19 and stay away from others, especially those who are at higher risk from getting very sick from COVID-19. What changed was that the CDC and the Connecticut Department of Public Health put in options to reduce the quarantine. The purpose of those options is to allow people who need to work and essential workers to get back to work, and also decrease the stress on public health system. We want to make sure that all of the things are available to everybody in order to help with getting the services and stuff. And if everybody's out sick and being quarantined, it's very difficult. Both the CDC and Connecticut Department of Public Health have said that a person, if they've been exposed after day 10, if they do not decide to get tested, or after day 7, if they have a negative test result, can return to work. Specifically, the 10-day quarantine says that the person must daily self-monitor for COVID symptoms, and day 0 is the day of exposure, and that daily symptom monitoring must continue after the 10 days for 4 additional days, and that if any symptoms develop during that time, that they must immediately self-isolate and contact their department, public health department, or their healthcare provider. And that after 10 days, they need to take measures to prevent COVID-19, including to, but not limited to, wearing your mask, when you're out in public, avoiding gatherings, again, social distancing, and avoiding those people who are at risk for COVID-19. The 7-day quarantine says that, again, you're going to self-monitor for those 7 days, but that you can get a molecular or antigen coronavirus test starting on day 5 or later, and then a negative test result can allow you back into work once that has been received. The quarantine should not end before 7 days, even if a negative test result was obtained earlier. And if the test result is still pending at day 7, that you need to stay home and self-quarantine until you've got the results of that test. Just like the 10-day quarantine, you still need to do your daily symptom monitoring, and if you develop symptoms, you must immediately self-isolate. And again, continuing those mitigation things to prevent the spread of COVID, including face mask wearing, social distancing, and avoiding people that are in increased risk for COVID-19. How does this affect schools? Well, let's go into the transmission risk so that people can see what happens. When you have a 14-day quarantine, there is a very low residual risk of having COVID-19 after leaving quarantine. As you can see, with the shorter quarantine days, there is an increased risk. Now, even at, if you look at the bottom one of 7 days, if you have the antigen testing, that is your highest risk. That is the one that's the rapid test that only sees that if you have the virus in your system right there, it, but is most likely associated with people who are showing symptoms. And at that point, if you're showing symptoms, you should be quarantined and isolated already. Okay, how does this affect the schools? The Connecticut Department of Education updated their contact tracing scenarios for school, which you may have heard of addendums 9 and 5. And they did these on Monday, and they are in line with the new quarantine options. The biggest difference is that each school district is being given the decision of whether or not to follow the new quarantine options as a policy or to remain with the 14-day quarantine standard. And I will tell you, throughout the state, there are a wide variety of choices. A lot of people are remaining with the 14-day standard, even though the state has said you can go down to the 7-day or the 10-day. And some are following right in line with the state. Private schools do have the option of following the new quarantine options or not. And for Newtown, the Newtown Health Department and the Newtown District will be adhering to the following guidelines. They are only accepting the quarantine period for persons known to be close contacts of cases of COVID-19 will now be 10 days if the following conditions are met. And this follows the same 10-day quarantine rules, that they do the self-monitoring, that the daily symptom monitoring continues for the 4 days after the 10-day quarantine, and that you again follow, make sure you're mask wearing, make sure you're social distancing and avoiding people with COVID-19. The Town of Newtown Health Department does not accept the 7-day test out within the school systems and within the town. This applies to employees and students alike. For Fraser Woods, we are going to follow the Newtown Health Department recommendations for the 10-day quarantine following exposure, and allow students to return to school if, again, the daily symptom monitoring continues for the additional 4 days. The biggest difference is we need to make sure that students are able to strictly adhere to mask wearing and social distancing. If they're unable to adhere to measures to prevent the COVID-19, then they are asked to remain home through day 14. The reason that we are putting in this information that they must strictly adhere to mask wearing is that obviously for a lot of our preschool students and some kids who are older, it is very difficult to maintain mask wearing throughout the day. A number of kids eat their masks. They are constantly wet. You'll find them below their noses and things like that. Though we do have other children who are excellent at wearing their masks consistently, and I could see them returning at day 10. But there are others that I just don't feel would be ready for it, and that's because they're just not old enough or mature enough to be as consistent as they would need. It's also something that as parents you need to understand is that your child, if they come back at day 10, will not be able to participate in sports or gym class, in recess, or other activities that will require sustained and close contact with other individuals. The reason for this is that obviously with sports and gym class, they're breathing much more heavily, and recess times without their masks on. So again, they wouldn't be able to strictly adhere to the mask wearing if they're running around outside and things like that for those remaining 4 days. This is going to be a difficult problem for some kids if they, can't do the sports or gym or recess or need that close time with their teachers. We need to keep the entire community safe. I do recommend the 14-day quarantine. I think it is the safest route for everybody. but we do understand that, you know, with parents working and things, that having this 10-day option, if your child is able to adhere to the mask wearing and social distancing, that it will be a good option. At that point, that goes over what the states have gone over and how Fraser Woods will be changing their policies. Going on to additional information, a lot of people are curious about vaccines. When am I going to get mine? I will tell you, I have gotten my vaccine. I am part of the 1A healthcare personnel faction within the state of Connecticut. I received my vaccine on Monday. I did not have any problems with it, have had absolutely no side effects, and I do truly believe that it is safe to get. Currently within the state of Connecticut, something to remember is that you have to be 16 years old or older to get the vaccine, and that's only with the Pfizer. For the Moderna vaccine, you need to be 18 years or older. The way that the government, national government, has come out with who's going to get what is through the Advisory Committee on Immunization Practices. They have set up a guideline for who they think and what the timing is for giving out the vaccines. The state of Connecticut obviously has approved the 1A healthcare personnel and long-term care facility residents. They are hoping actually by the end of this week, or at least at the latest the beginning of next week, that all long-term healthcare facility residents should already have received it, and they are ongoing with healthcare personnel. Beginning in the end of January, the goal is to start the 1B section of people, and it looks like teachers will be part of that frontline essential workers and getting that, getting the vaccination. It is not for sure. The state of Connecticut has not completely red stamped it as of this morning, but it does look like that is the way it is headed. The majority of healthy people without any medical conditions and things that are put into higher slots will be that probably this spring or summer we will begin vaccinating everyone else in the state. And they have, the state of Connecticut is working very hard to make sure that we have enough vaccine and that we are getting consistent deliveries of that vaccine to the state. Obviously, with what's gone on with the government, not as much vaccine was ordered as could have been at a time. I think they were banking on more people coming up with vaccines that were going to be accepted by the FDA. Some of them right now, I know the Moderna and Pfizer have been accepted. It looks like Johnson & Johnson is up for the next possible one. The AstraZeneca vaccination is actually taking a little bit longer to get approval, and that has actually been, a stop has been put on that, I believe, until they can provide more information. Regarding the vaccine, people are very concerned. They're like, oh my God, they came up with this vaccine overnight. Well, it didn't come up overnight. The groundwork for vaccine development started with both the SARS virus and the MERS virus, starting in 2002. These are both coronaviruses that were definitely pandemic worthy, but the viruses themselves sort of burn themselves out very quickly. But people were already working on how to deal with coronaviruses and the best way to come up with a vaccine. So this has been something that has been going on for a number of years and has led to the development of the vaccines as quickly as they have come about. The vaccine does not contain any materials of animal origin. There's no egg, no fetal tissue, and it contains no preservatives. This is part of the reason why a lot of the vaccines are being kept at very cold temperature, is because it doesn't contain preservative, and it also keeps the information within the vaccine in a stable form. The vaccines use what's called messenger RNA to instruct your cells on how to produce a protein that triggers your immune response. It's sort of like sending an email to your cells in your body. Your DNA reads that email and says, hey, let's go and make this protein and make it happen, so that we can not be affected by the virus. This is different than other vaccines that that everyone has received in the past. The vaccine does not contain any part of the virus itself. Other vaccines have contained what they call attenuated or dead parts of the virus, things that can't produce the virus in your system, but that definitely had parts of the virus in it. This vaccine has created a chemical way to send this message to our cells to produce the immune response. It does not contain COVID-19, and you cannot get COVID-19 from the virus. The vaccine does not alter your DNA. All it does is give it messages. And while the vaccine has been proven to help prevent you from getting COVID-19, it's not 100%. You could still get COVID-19, but the likelihood of you having any type of serious virus with the vaccine on board is greatly reduced. There are some short-term, mild, moderate side effects to the vaccine. I will tell you the only thing that I got was a little bit of a sore arm. But that happens with any vaccine. It happened with my flu vaccine earlier this year as well. The allergic reactions that people have heard about, they're extremely rare, and they generally occur in people who have already had a severe allergic reaction, either to the chemicals that are in the vaccines, or in general that these are people who have had EpiPens before and are, more likely to have allergic reactions. People who have had COVID-19 should still get the vaccine. There have been a few cases of people who have gotten COVID-19 twice, and there are instances where they're not sure how long the COVID-19 antibodies last in the body. Right now, they're estimating at least 9 months because that's how far they have data for. But then it obviously hasn't been with everybody because some people have gotten it twice. So having the COVID-19 vaccination is a good idea, even if you've had COVID-19, to help prevent a further reoccurrence, and if you do get it again, any severe reactions. The most important thing is to remember mask wearing and social distancing is still going to need to happen, even if we all received the vaccine. At this point, we do not know for sure if you've had the vaccine, if you can still carry the virus and give it to other people. All we do know is that the likelihood of you getting the disease, and if you do get the disease, having serious problems with the disease, are greatly reduced. We do not know whether or not you can still give the disease to someone else if you've had the vaccine. So we are still going to need to wear our masks, do our social distancing, and this is going to continue for a while, which is a hard thing to accept because we're all just weary of dealing with COVID-19. One of the big things that everybody's been talking about is all the variants of COVID-19. Viruses are constantly changing. We know this. When you look at the flu vaccine, we get a different flu vaccine every single year because the viruses are changing and how they're showing their symptoms and how they're contagious, and we have altered the flu vaccine every year to go accordingly with this. They are constantly changing through mutations, and it is normal for new variants of a virus to occur over time. Believe it or not, they say there's probably already been 20 or 30 different variants of the COVID-19 virus, but the majority of them soon after they emerge, they quickly disappear. Occasionally, as is happening now, some are emerging and they are persisting. What they are finding is that these variants, there are 3 of them that they're watching right now. I'm sure everybody's heard about the one from the United Kingdom. There's another one from South Africa and another one from Nigeria. These variants are showing themselves to be about 50 to 70% increase in their ability to spread more easily and more quickly, but they are not showing that they could cause any more severe illness or risk of death. The pictures down below, the first one is the COVID virus that we're all used to, the picture we're used to. The second one is the United Kingdom virus. The third one is the South African virus, and the fourth one is the Nigerian. A lot of concern has been said about the South African virus because, as you can see, the little spikes on the COVID-19 molecule are very differently shaped. What has come out is Pfizer said this morning, it looks like their vaccine is still able to be of use against the South African variant. They're not showing that it is not effective anymore. Just the opposite, they're showing that it is still effective, and they expect that to be the same through with all of the other viruses. Last thing I want to go over is what's going on today with COVID-19. This is from this morning's, I got this right off of the Connecticut website to show what's happening in Connecticut. We had another 3,304 cases yesterday in the state of Connecticut. We're doing over 50,000 tests a day. Yesterday, I know that our hospitalizations decreased by 52, but we also had 57 deaths. But that does mean that there were less people admitted to the hospital yesterday, and that's good. But I think these numbers show that within the state of Connecticut, that we are still dealing with a high rate of disease, and we all need to continue to be vigilant. Within the world, there have been over 88 million people confirmed to have COVID-19, and we are approaching 2 million deaths. Within the United States, we're approaching 22 million people with confirmed cases of COVID-19. There were almost 300,000 new cases yesterday, and we are approaching quickly over 400,000 deaths within the United States. This is very sobering information, and I think that we just need to keep that in mind when we think, oh, it's not a big deal if we go to the park and play, or if it's not a big deal if we go someplace else. My next door neighbors, I know they're fine. We don't know, and we just need to continue being safe and doing the best we can so that we can keep our kids here in school. I do know that the teachers and the staff here are being vigilant in their cleaning, they're being vigilant in their self-care, and the people that they are associating with, making sure that they take care not to be exposed. I believe that the majority of the people here, family-wise, are doing the same thing, and as long as we keep doing this, we can keep being here in school. Thank you. I know we're going to probably have some questions now. I can't see if anybody's put any in. I think Allison has been looking at that. But if you have any questions that you want to talk to me about this afterwards, please feel free to contact me. Everyone knows where to find me, and we'll go from there. Okay, I'm going to stop sharing. Hold on one second. How do I stop sharing?
I did.
Oh, you did? Yay!
Yeah.
Okay, good. So does anyone have any questions, concerns, anything?
Hey, Christina, it's Carol. I joined late. You may have covered this. If you did, please don't. Like, how do you think we're doing as a community?
As a community, we are doing awesome. I have to say that I think that our parents are very aware of what they need to do to help prevent the spread of COVID-19. Most families are being very good about, quarantining themselves in their home and not doing unnecessary trips. Is it 100% across the board? No, because we're all human and we have things that we have to do and people have to work. And but I think overall we're doing very well. I am doing my best to keep, aware of anybody who has had an exposure. We're being very careful about monitoring what people's symptoms are and things like that. And really, I've got to say the parents have just been great when I've said, no, you need to stay home for the full 14 days, everybody has really been doing it, and that's wonderful. And giving me the copies of their COVID tests and all that good stuff. Anything else? I think that just the most important thing is to remember that even with all of the information that we hear every day about, oh no, this variant has come and we have to be more cautious and stuff, that we are doing what we need to do. And as long as we keep doing it and continue to be vigilant, we should be okay. Does that mean it's going to be perfect and that we're not going to have to shut a classroom down or go times? No, it doesn't mean that, because things are still going to happen. People are going to be exposed. You can't help it when you're dealing with something that now they're estimating to be 50 to 70% more contagious. And people, as I said, still have to go to work and all these things. It's going to happen. But I think that we've come up with a plan of how to deal with it. And I think, as I said before, our teachers and staff are doing an amazing job of watching. I think of Michelle out front every day when the teachers come in right to the school. She takes everybody's temperature and goes through the questions with every single one, including me, every single one of the teachers and everything before we even come into the school. And then the teachers are doing it for the students, and the teachers, if they have been exposed, are letting us know right away and quarantining themselves. And we're all being so careful. And you see everybody going around and constantly using the hand sanitizer. And the kids are so good when I'm like, hey, get that mask up over your nose again, or whatever it is. The kids are incredible. And I really do have to say that. The kids are incredible about wearing their mask and washing their hands. And, I've got a thing of lotion in here that kids come every afternoon to get lotion on their hands because their hands are cracking and they're red and stuff, because they are washing their hands and they're doing the hand sanitizer and doing what they need to do. And I think they deserve to really, be applauded for their efforts. They get it. And it's not, I think it's more traumatizing in some ways to us adults than it is to the kids. They're like, oh, we're wearing a mask today, but I have mine that has, little unicorns on it or something. They're happy. So, all right. Does anybody have any questions or anything that I can answer?
I have another one, but I don't want to monopolize.
Go for it, Carol.
Okay. Curious, is there any data yet with the new strains of the virus relative to the effectiveness of the current vaccines?
Yes, and actually Pfizer reported this morning, that they are finding that the new variants do seem to be affected by the vaccine. There's no reason that they shouldn't be, because it's working with the proteins within the spikes on the vaccine, or excuse me, on the virus, and all of them still have the spikes, though specifically with the South African, I know the spikes have changed, but they still contain the same proteins. And so they really do feel that these variants will still be taken care of with the new vaccines. If there are new variants, this is going to change, and they're going to have to change the vaccines to, accordingly. But because it's the vaccines as a whole have already gotten their emergency approval, they can, if they need to alter them, it's not working from ground zero again, that they can alter the messenger RNA that they're putting into the vaccine to affect new ones if they need to. It may take a little while, but You know, it's not starting from ground zero. They need to alter the vaccines. Anything else?
Doesn't look like it. Thank you. I'm gonna turn it over to Gina now. For her. There you go.
Good.
Oh.
Unmute yourself.
Thank you. Thank you guys. Thank all of you for coming to today's coffee and chat. It was an incredible amount of information. So if you do have questions that come up after we leave here this morning, please don't hesitate to reach out. Christina is always available. I want to say thank you to Christina Benoit. We would be lost without you, my friend.
I'm not going anywhere.
You do so much for so many of us here. So thank you so much for putting this together for the community. I appreciate it very much. Thank you all.